Hello, Janelle. I'm excited to speak with you today. You and I first met in 2016 when I did a site visit as a CDC Global Health Fellow to Kyrgyzstan for a regional workshop on blood safety, while you were the Deputy Director for CDC in Central Asia. You spent over 15 years advancing global health across regions, from managing HIV programs in Vietnam as a CDC fellow, to leading health system strengthening efforts in Central Asia, to advising the Ministry of Health in Ukraine on governance, immunization, e-health, and financing reforms, to serving as CDC Regional Director in Guatemala, and now as Regional Associate Director for South Central Africa, overseeing PEPFAR programs across 5 countries. Your journey spans technical, managerial, and diplomatic roles, all with a focus on reducing HIV incidence and mortality while building stronger health systems. I'd love to hear how you've navigated these diverse contexts and what lessons students and others interested in global health can take from your leadership.
Absolutely. Thank you so much for having me.
Okay, great. So the first question I have for you today is about your work across Asia, Central Asia, Eastern Europe, Latin America, and Southern Africa. What drew you to a career in global public health in the first place, and what has kept you?
Yeah, it's a really good question. And, just thinking about how many of your students might have gotten interested in global health or just public health in general, I actually didn't know about public health until I graduated from college. And I went on a missions trip to Honduras, and I was working on a mobile clinic there. And I was doing, just helping one of the physicians. We were going out to different clinics every single day. And I was, counting pills or taking vitals. And I kept on telling the doctor, one of the things that we should probably do is go to the communities and teach them about XYZ. I don't remember exactly what the issues were, but we were seeing the same thing over and over. And so the doctor was like, yeah, but we need to go to the next, clinic the next day. And so after that experience, I was telling my mom about this, and she's like, Janelle, have you ever thought about public health? And I thought, what is that? So I looked it up and I thought, wow, this is totally for me, because I was going to go and be a doctor, and I was like, I'm going to go help people, And so it really helped solidify looking at the population's health versus individual health. And so I applied for a lot of public health degrees. And then I also did a gap year between my undergrad and my graduate school to go work in some mission hospitals, one in Ecuador, one in Malawi, and then one in Honduras or in Guatemala. And that's where I got a little bit more knowledge about how to do public health in global settings. I think the thing that's kept me is a strong connection to the work and the outcomes. It truly gives me so much meaning to be supporting other people around the world and to be seeing how we can bring health and ideas to the rest of the world. And so when I see that daily, or I see that in reports or whatnot, now that I'm not in the field directly anymore, I'm at headquarters. That continues to give me some just like an immense amount of meaning in my work. Yeah.
Okay, wow. Um, that's awesome. And I heard you mention Guatemala. I also spent some time in Guatemala, such a beautiful country. But let me ask you about your role as HIV program director there, and now associate regional director for Southern Africa. Those very different places, and you oversee multi-country PEPFAR implementation. Can you tell us about the quick history of PEPFAR and what has made it such a unique public health effort and how it looks in different places like this?
Yeah, I wanted to I think that it's a great question about PEPFAR. And, I've had different roles in different countries around PEPFAR. It's such an important initiative to understand because it is the largest amount of money given by one nation for one disease in the history of the world. So in 2003, President Bush went to Southern Africa and he saw people just on the streets dying of HIV. And he and Laura Bush were moved so much that in the State of the Union in 2003, they announced PEPFAR, the President's Emergency Plan for AIDS Relief. they, together with Congress, a bipartisan Congress, thought that this was going to be, a really important, not just diplomatic, but humanitarian effort by the US government.
Mhm.
And so, again, such a unique effort because what they did was the Congress gave $6 billion for 6 different US agencies, including USAID, CDC, Peace Corps, and others, to go into these countries in Southern Africa, particularly, and now around the globe to address this one issue of HIV, because it was having such an important and just a huge impact in Southern Africa. I mean, 1 in 3 people in some of these countries were living with HIV. And so over the course of 20 plus years, we've supported more than 21 million people on HIV treatment and saved their lives. Like without this money and without these resources, Southern Africa particularly would be decimated. Um, and I will say also around the globe, it got really a lot more traction where we were able to sort of make inroads in prevention in Western or Eastern Europe, Southern, Southeast Asia, and even in Latin America. And so, this has been just a unique opportunity to not just go in and give people treatment, but also to build the health systems with countries to respond to not just HIV, but a lot of pandemics and epidemics
Mm.
around the world. And so I just wanted to kind of give that history. Right now, we're in a downward trajectory of PEPFAR. If you looked it up on the news, you'll probably see a lot of news articles about it. And just having that information and that knowledge of what it is will give you some context around like where we are with PEPFAR right now. But in a nutshell, that's where PEPFAR came from.
Yeah, yeah. Thank you. That is really helpful context, and it's a great program to think about historically, looking at what's going on in the world now in global health. So thank you for speaking about that. And now a major regional shift. I want to ask you about Ukraine, your
Yeah.
experience there. I know that you supported major health reforms in governance, immunization, health finance, workforce development. What is the role donors and other non-governmental organizations play in supporting the host country to create new systems? And just so you know, we focus on donors and financing a lot in the global health course.
Yeah, it's a great question. I loved going to Ukraine. So I went in 2018 to 2019 before COVID and before the war. And so it was an unbelievably exciting time to be in this country because it was kind of like a teenager, like maybe like you all, like, a lot of ideas and you're fresh and you're, willing to take on new ideas. And I will say, like, when I went to Ukraine, the technology in Ukraine was outstanding. There was innovators, entrepreneurs. There was new restaurants popping up everywhere. Just so much excitement about the future of the country, and systems were developing in rapid form. And so, President Zelensky had just gotten elected when I got there, and he wanted to reform the healthcare system. And so USAID came in. I was working with USAID at the time, and we actually were like, what we need to do is we need to bring in their consulting company and our consulting company from the US and bring them together to learn how to build some of these systems, especially electronic systems and ways of moving some of the medical systems and medical schools forward as well. I loved working on that because it was truly a partnership. We learned from them, they learned from us. We were bringing ideas together and kind of ideating and discerning and kind of thinking about whether this would work in their context. And, again, I just want to just highlight how much of a partnership it was. And we were able to learn so much from their experience and how they developed their own healthcare system from primary care to secondary care to tertiary care, and how they were able to form these things we don't use in the United States called catchment areas, where there's an area where a primary care facility or a doctor takes care of the public health and the health of those people in that catchment area or that district or that group, right? That's something we don't do in the United States. And I think that that idea, bringing that back to the United States, has actually helped me think a little bit more about how we can do preventative healthcare better. And so, just thinking about ways of donors and non-government organizations supporting a host country with ideas, and that host country being willing to open up to new ideas is, I think, the ideal partnership that we look for globally, because we are a global community, right? And there's so many things that we can learn from each other in different contexts. So maybe I'll just leave it there of, the donors and non-government organizations aren't just coming in to save people. They're coming in to support where there is needed catalysts or ideas, or, just a little bit more support in a certain area.
That's a point I always want to get across to my students. Thank you for saying that. This partnership is where the success is.
Mhm.
Jumping to another regions of the world that you've worked in, regarding health system strengthening. It's been a core part of your work, from Vietnam to Kazakhstan to the Democratic Republic of the Congo. What elements of systems strengthening, finance, workforce, e-health, governance, have the most immediate impact on HIV outcomes?
Yeah, I think just taking a step back and thinking about health equity is so important, and something as an undergraduate, I did not understand this because of the way that I had grown up. I had grown up with a lot of privilege, being able to access, my parents encouraged me to go to university. They encouraged me to, get internships, and they encouraged me to, you know, do XYZ, right? So I didn't really understand this concept of like other people did not have that. And I'm like showing my ignorance right now, but um, it's also very humbling to realize that. And when you start to understand that not everybody has the same opportunities or privilege, you might think, well, they just should do things better, or they just should think the way that I do, and then they'll have a better life or whatnot. And so I think what was helpful for me in thinking about how to bring HIV programs to um, and build the systems, we're really thinking about systems that would serve the population in a way that they could access it, that it was low cost, and that it was at quality, right, for them. And not being judgmental or, putting shame on them for not being able to access things or whatnot, but just thinking about, okay, what if we do an e-system that would help, electronic system that would help people check into their appointments. These people, some of them don't know how to read. And then others have these amazing iPhones that they can do whatever, right? Thinking about the different access points, or maybe budget, right? So some people would have to travel really, really far to get to a clinic. What does it look like to do telehealth for them? And so these are some of the systematic things that we would think through to get access to populations that needed them. And sometimes it takes a little bit more money and the resources, but then you have to think about what is your goal in doing it. Your goal is to get access to certain populations, to be able to impact mortality and morbidity. So it really depends on what the issues are in the community, to what systems you need to build to get access for those populations. I hope that answers the question without getting
Yes.
more technical and like health financing and things like that. Yeah.
Yes, and because I'm always trying to remind my students of, that these issues also exist in different ways, potentially in the United States, I just want to take a moment to say, like what you mentioned about equity and trying to tailor interventions to places based on their context, like where people are illiterate, having other information available to them, so to get across information. So like I spent a year working in rural Southern Illinois at an NGO, and a lot of the people I worked with lacked, there was no public transportation, struggled to get to medical appointments, and there was a lot of illiteracy. So I'm just adding that here to say that though this is present in different countries in different ways, we also have it in the US, and it's important to consider when we try to bring public health to different groups of people.
Yeah, and maybe to your point, Larissa, that's such a good point. let me bring it down to your students level. That's something that they might be thinking. I am super interested in fitness and nutrition just because it's
Me
part of
too.
your, daily, like it's part of your, when we look at things that pop up in the news, it's like, you need to do fasting. You need to be lifting, weights. You need to be doing, cardio. You need to be doing this. If we look back at the research on this, it is done among men ages 18 to 40. We are not men ages 15 to 40, right? It is so easy to do research on young men.
Mm,
Very predictable. They have their willingness to be part of studies, their the access, and just their, just they are in that growth pattern, and they have regular cycles, right? Every 24 hours. But if you think about equity, and you think about putting something like that out there, that is completely dismissing that women have a different biology than men. And when you're looking at research, you need to be incorporating people from different groups in order to get better recommendations for that group. So we now have started studying women and what does that mean for fitness and nutrition? And it
mm.
turns out, like, as
And fasting.
it's not good for us to do fasting, or we
Exactly.
do need to be lifting heavy weights, but we do need to be doing these other things, and like all these other things that kind of come out. And it's like, wow, that's a very good way of kind of bringing it back to us, because we don't usually think of ourselves as beneficiaries of public health, but we are. By looking and research, like looking at these, clickbait every single day, you have to go back and look at what was researched in order to have those recommendations. And we need to bring equity to women and nutrition and fitness. Just a side note.
Yes, in the US and everywhere. Yeah, we can go down a whole rabbit hole, but thank you.
Yes.
But I'll take us to the next question. I'm on board with you on everything there. Um, but next question. You've witnessed CDC's global role evolve over 2 decades.
Mhm.
How has the agency's approach to partnership shifted from doing programs to helping countries own them? And what does true partnership look like on the ground? You've already talked about partnership, so we're bringing it back to this.
I think it's a lot about staffing too. So now at headquarters, we have a lot of staff from the countries that we've worked with. They have a lot more knowledge now of HIV than we do in the United States. We have a very concentrated epidemic of HIV in the United States. And so bringing in people from places in Southern Africa or Southeast Asia has helped us develop ways of doing our programs better in the United States as well. And so I think that that partnership has helped. I think the other thing is just, like you have to reduce money. And that's what we're doing right now is you see this squeeze of money, and that ultimately forces countries to sort of take up the financing and the responsibility of their global or their public health systems or not. And I think that that's there's a lot of news articles about that, and there's pros and cons to how quickly you do that or how you do that. But that's another way of that ownership of the health in a country. And so that's what I've also seen over the years, and especially over this year, of how CDC and other donors have started to really kind of move on what does that look like. It also looks like transaction, right? Like you do this, we get this. If you do that, we get this. And you see that a lot happening right now is this shift from humanitarian assistance to global partnerships and what that looks like. And again, there's different ways of doing that and how you do that. But that's one of the ways that this trend of global health is trending right now.
Yes, thank you. Um, let's bring this back also again to the students. If you could go back and talk to yourself as an undergrad, what's one mindset or habit you might tell yourself to adopt early to get into global public health? And you could think
Yeah.
about this also in today's context.
Yeah, develop the hard skills. If you want to go into public health, you need to do, epidemiology, you need to do, health system strengthening, you need to learn statistics and all of those things. So just considering that you have all of those, here are my top three, here's my top three advice for you. that you may not think about. One, network. You may think that your boss is going to be the person that gets you your next job. It is not true. You have to network, 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 network. So part of that is like, just take your professor, for example, Larissa, right? She reached out to me on LinkedIn. She is building a network, and she probably reached out to a lot of people, probably a lot of people know her, but some people won't, right? And like they will build this network of people who like in the future, be like, oh my goodness, Larissa's at University of Knoxville, and vice versa. Janell's at CDC. You need to be intentional about that. Reach out, be weird, be obnoxious, be awkward, and put yourself out there. That is the way that you will get a job. Like 90% of global health jobs is when you know somebody. So network, network, network. Do some research on that. The second one is learn how to communicate. Y'all, with AI and your screens in front of you, with the Instagram, with the TikTok, with all of these things, you need to create your leverage by being human. And what does that mean? What is the one thing that AI can't do? What is the one thing that TikTok and whatnot? As a human, we are wired to be connectors, right? You need to learn how to communicate. Put your phone down and actually communicate. I was approached by a billionaire entrepreneur, and he was like, if you can come into my organization and teach Gen Z how to communicate, I will pay you a lot of money. Like that was what he wanted. He's like, they don't know how to communicate. So if you're like the one person who can communicate and connect with a leader, you got the job. But if you think that continuing to, like, the people who are hiring now are millennials and Gen X, right? They don't communicate the same way that you do. And you thinking that they will communicate and bring you on board, that won't happen. They will continue to hire their own people. So if you want to get in the door, you need to figure out how they communicate and start doing that. And that happens in real life. And it happens, not over over TikTok or over, but it can happen on LinkedIn or, some of these other things.
Personal messages.
And then maybe the last one, and this is probably going to be really surprising. If you want to go into global public health, you need to learn how to develop a budget. Money rules everything. It's a business, it's an organization, it's a system. And if you don't know money and how money works and how the business works and how budgets work, it will be very difficult for you to go into being a leader in this area. That was the most shocking thing for me is, wow, when I knew how to do a budget, I like skyrocketed into leadership. They're like, oh, she knows what to do with money. I will trust her. Now, in my personal finances, that's not the same thing. But in public health, it has really helped me understand like that is going to work. That's not going to work. That's the rules of the game, that, all of those things. So network, learn how to communicate, and know how to develop a budget would be the three things that I would take away from, like, I wish I knew as an undergrad.
That is great. That's actually another interviewee also said something about that, particularly in terms of like the current times. Like we're aware, I think people are well aware from the news that one of the major changes in global health is funding. And
Yeah.
so how can you be part of the future of global health is learning how to work in funding contexts, in funding constraints with donors, things
Yeah.
like that. So those are really good skills. That's awesome. Thank you. And then let's close this with a last question, a bird's eye view. What do you think as the future of HIV programming under PEPFAR? And how do you see it connecting to the broader health system and global health equity agendas?
Yeah, I want to be really honest. I'm so excited that you asked me this question. I don't know. I don't know. And a lot of people don't know. And this is a really exciting time for students to be in school right now because, and this is what I tell students all the time and grad students, you are on the cusp of what was and what will be. And you get to design that. And if you don't take advantage of this opportunity right now to do that, we will not have a future for public health. Because what's happening right now, and it's not necessarily, a bad thing, a good thing, a neutral thing, it just is the entire world, not just the US, but a lot of donor countries are reducing their assistance money and trading it in for how do we do more transactional deals, right? And that could be in health or in, um, you know, trains or, whatever. It's all sort of like very transactional as a global world. And so I think that the future is understanding that and understanding how to move in that direction where there's still a lot of, there's still a need for just direct assistance, people that are just like in complete need of, really support. But then there's other places that need technical support or a partnership or something like that. And how do you do that through private organizations, like the private sector? How do you do it through foundations? How do you do it through UN organizations? How do you do it through non-government faith-based organizations? Um, or through the US government, or through other governments. And so I don't know. And that is coming from somebody at a pretty high level in PEPFAR right now. And they don't know what the future is exactly. It needs to be designed. A lot of what will happen with PEPFAR will probably be the way that a lot of other things happen in terms of global health security or whatever happened with COVID or, pandemic response or readiness. And what does that look like to do that partnership in global health to be ready for that next pandemic or the next global health threat or whatnot? So, yeah, maybe I'll leave it there and just offer some inspiration and maybe maybe some of you are thinking, is it even worth it to go into public health if there's no funding from the US government? Yes, there is. There are so many other organizations that are so like the Gates Foundation or again, faith-based organizations. Private organizations as we have globalization in our private sector. Chevron, they have a huge program for working in the communities that they work in. What does that look like to expand that? And so there's a lot of different opportunities out there. It just is sort of looking for those and then figuring out what works for you.
Yes. Thank you. I love ending this on a note about like reality, meeting reality, and seeing how you can be effective and create like real change while acknowledging all the ways things are shifting, the mystery, sort of the doubt, and using your skills and seeing where you can put them to
Yeah,
make a difference. So yeah, it's a good way to end this. And thank you so much, Janelle, for your time, for sharing all your wisdom, your experience. And yeah, I hope people learn from this, students and other people interested in global health. So thank you.
absolutely. And you can always contact me on LinkedIn. I am happy to talk with anybody if they're interested.
Wonderful. Okay, thanks so much.
Absolutely. Thank you.